Okay, cool.
Okay.
It gave me options, so I wasn't
Yay.
sure. Well, thank you, Ravina, for joining me this morning. I really appreciate your time and your insights on this.
Yeah, thank you
Um,
for having me.
yeah. So we were just going to have a quick discussion about your journey in physical therapy and specifically scoliosis
Mhm.
and how you ended up in our course and what your thoughts were on the PSSE Shroth method by Nikos.
Yeah, so I have been practicing for 7 years now, which is crazy because it feels like I was just graduating yesterday.
No.
But I've primarily worked in outpatient orthopedics and neuro. And sprinkled in there, I've done a little bit of early intervention and also worked in aquatics. And my clinical instructors always gave me the advice to become a really good general outpatient physical therapist first, and then specialize down the road after you find what you're passionate about. So that's pretty much what I did. I gained a lot of exposure with patients with different diagnoses, learning how to manage challenging personalities, and I waited to gain all that experience before I decided to specialize. So when I was in physical therapy school, we came across the topic of scoliosis. We got one little slide on it, and they did
Oh,
mention,
sideways over the ball.
yeah,
It
but
may have been the
luckily,
same slide.
yeah, they did mention though that there was something called Shroth method, which could help with
There you
scoliosis. And
go.
that's kind of when the seed was planted that, we can maybe do something for scoliosis, which we didn't really know was possible before.
Right.
So that was kind of when the seed was planted. I personally have a connection to it because my sister had scoliosis. So when she was like 11, 12 years old, she um, was called into the nurse's office and they did the forward bend test. And she came home with a little, like page that says, yeah, you might want to get checked out by your doctor because we had a positive forward bend test. So um, at the time, they were recommending just waiting and watching. And
Oh,
her
yeah.
curve quickly progressed. And she was now a surgical candidate before long.
Did
Um,
that go fast?
it went pretty fast. Honestly, I don't remember
Yeah,
how
yeah.
much time was because I was only like 14, 15 years old at the time.
Mhm.
So I'm not sure how much time there was between first getting that initial diagnosis
Yeah,
and then becoming a surgical candidate, but I do know that it progressed pretty quickly. And my parents got multiple opinions, and both
right.
surgeons said surgery is the best case. So she did end up getting a fusion. And I remember thinking and seeing like everything that she was experiencing. Um, and we all kind of felt a little bit helpless because we didn't really know much about scoliosis,
Right.
and this is like a major surgery that she was having, and all of the emotional and mental impacts
Yeah.
that it had on her as a, very young girl. Um, so, when fast forward to physical therapy school, when we learned that there was something that we could do for scoliosis, I was like, wow, maybe I could, help other people that are going through the same thing and I could be there for them. Um, just as how I wish someone was there for my sister.
Yeah.
So yeah, that's pretty much like how I ended up, with the idea like maybe down the road I could do something for scoliosis. And, that's how I ended up here.
Yeah, that really personal experience in any illness or condition or something always kind of brings that extra layer to
Hmm.
our work. And it's interesting. We share the same backgrounds in early intervention and aquatics too. And I always remember somewhere along the line I had heard, I don't know if it's actually research based, but something like 33% of siblings of children, with a condition or a developmental issue or something will end up going into healthcare because of that family and personal experience thing. And scoliosis is obviously another one like that. And especially for your sister, whose case probably was going through peak velocity growth that we now,
Yeah.
which we didn't know back
Yeah.
then, right? And in
Yeah.
all fairness to the entire world of providers,
Yeah. It was
so
like
much,
15, 16 years ago. And I think,
right, right.
like it wasn't
Yeah.
a big
I
thing
mean,
then.
we just didn't know that about peak velocity growth that much. And we didn't have the tests, to really discern when a child was or was not, heading into it, heading out to it. We only had these kind of sort of larger ranges. Now we know with the Sanders test, we can be more specific. But even if we had known, it was pretty clear general PT just didn't play a role,
Yeah.
especially since most kids don't have pain. And
Hmm.
I always said, heck, half of them are like athletes, like,
Yeah.
competitive, nationally ranked. And we know we have examples in our communities of Olympic level athletes. Like, so we're not exactly talking about, weakness or, difficulties with function. They're functioning at a very high rate, but just with a condition that, like you said, it ends up making us feel as healthcare providers pretty helpless, don't
Hmm.
have much to say from an evidence-based, to now these last 15 years have really started to provide not only the clinical experience, but the research that really has changed. We know it's changed kids' lives, right? We see the
Yes.
kids that have curves that are halted and reduced even, which is the new emerging research for growth modulation. And we question if some of that really early application in higher dosages is a high enough force to change the shape. And isn't that fascinating? If we can be part of the solution to even some reduction and changing that, I think is really fascinating. And
Yeah.
now you get to bring a whole lot of heart behind it as well,
Yes.
which, we always talk about the fact that parents will always, desperately search for like the leading surgeon and the best brace. And now that Shroth is maybe a little bit more um, known and available on internet searches and so forth, they might even search for that. But it's so often that they don't even stop to ever consider the mental health side of something
Hmm.
like that.
Yeah.
Um,
And
it
that's definitely
because it
huge.
not only impacts the person going through it, but for parents, I as a parent, and now you're a new mom, right?
Yes.
It's it's a whole other ballgame when we're thinking about trying to make medical decisions for our children
Yes.
that are lifelong, like the
Yes.
idea of a major surgery. I remember when my daughter had a major, she had a Macy's procedure on her knee, and it was going to be a two-stage surgery and a year-long process. I mean, that was huge.
Yeah.
And really the urge to just kind of get as much of the research under my belt and really understand as much of it as possible to help her. That drive was serious.
Yes, no, I completely understand. Like I was telling you before, how my daughter was diagnosed with a tongue tie, and I didn't know anything about the tongue tie world. Like I didn't
Yeah,
even know it was a thing. And we do like these deep dives into the literature, and sometimes we still come up and we're like, I still don't know what to do.
yeah,
And I can only imagine how my parents or other parents that were going through that like years ago, like were feeling because there wasn't a ton of research back
yeah,
then.
right?
So the amount of helplessness I felt with my daughter's situation compared to like what parents were feeling like years
I can
ago, I can
imagine.
only
Yeah,
begin to
yeah,
imagine.
yeah, I know. So you ended up getting certified
Yeah.
in scoliosis specific exercise
Yeah.
from your first school certification was BSPTS, right?
Yes.
Yeah, just like ours. I was in one of the earliest, like 2009, and
Yeah.
Dr. Manuel Rigo himself came over in Wisconsin with Beth Jansen, and it was a great learning experience. I think we had talked about the fact that I was kind of auditing the course at the
Yes.
request of a spine surgeon colleague of mine. And so I wasn't even thinking of practicing it because I too was doing early intervention and I love my babies, and far less prevalent in terms of,
Mhm.
infant scoliosis. I mean, we occasionally would see something congenital, or occasionally see something like early onset. And of course, neuromuscular scoliosis was, considered at the time to be completely different from idiopathic. So they were like in two separate boxes for me. So I really had could not have envisioned 15 years later, to not only be treating adults, but scoliosis, doing research. It's just been an amazing 15 years of experience. But certainly BSPTS gave me my starting into scoliosis specific exercise. But then as Chintan and I, in our owning our practice together, we really are constantly searching for that next level of
Mhm.
education, because we really strive for that comprehensive skill set, that more nuanced body of knowledge, because we know how variable patients can be, how individual they can be, right? You've got some that fit in the boxes of the curriculum and some that don't. And so the
Mhm.
longer we were practicing, we were kind of developing our own thought process, because certainly 15 years ago we didn't have the same amount of volume of mentors that we could easily reach out to and just shoot the breeze and exchange cases. I was sharing with Melinda that those first years, Chimpin and I were like with our books and just treating with the book on the side. We were so nervous
Yeah.
at first, but it evolved into us taking courses with ISST. I took the ISICO master's course. Chintan and Becky took the CIAS from ISICO. And we were just constantly going towards an increase in that comprehensive skill set to see what pieces we might be able to add on top of. And certainly participation in Scoliosis Research Society and SOSORT continues that collaborative, multidiscipline experience. But there's a piece of me that has always been very algorithmic in my own thought process, in my own clinical rationale. In my head, when I have an individual person in front of me, I go systematically, right? It's just how I
Mhm.
kind of learn best, but it's also how I clinically think. And I remember when we first came across Nikos's algorithm for this, and I was like, oh, that's what
Yes.
we have been doing with our patients, but not explicitly in an
Yes.
algorithm tree, which
Yeah.
I love an algorithm tree, just the visual of it.
It's great, honestly. The
Yeah,
algorithm
yeah.
is so amazing.
So tell me what your thoughts were finishing, now that you finished level one PSSE Shroth and you're coming from another school. Tell me what your
Mhm.
thoughts were. What did you take away that you found really valuable in that?
Yeah, I think so, like you said, it's very common for therapists that are certified with one school to seek out other schools to develop a more comprehensive knowledge base. So I didn't feel like I knew everything at all coming into this. I was very much looking for like what gaps are there in my own thinking and how can I improve?
Mm.
So I think this was a great opportunity for me to learn more. Um, I think the algorithm is amazing. I love it so much. I think it's very clear, and concise, and it gives a lot of direction, especially to new learners.
Yeah.
It's wonderful. I think it also answers a lot of those clinical questions, which probably come up the more you work with patients with
Mhm.
scoliosis, about, like when they don't exactly fit to the T of like what a particular curve type is,
Yeah.
um, like what to do then.
Yeah.
Um, so I really think that the algorithm really helped with that. I so just a little bit of my background, like I got certified with BSPTS at the end of 2023. Um, so I only had a couple months before I went off on maternity leave.
Mhm.
So I felt like I really needed to like learn more about scoliosis in general and what the treatment approaches are. Um, and then having that little bit of a gap, like the maternity leave, and then I decided to work per diem instead. So I did have a little bit of a gap in between, working with patients with scoliosis. So this was actually a great opportunity for me personally to, um, you know, put myself back in there and remind myself about the different curve types and how we go about with the treatment and things. So I think it was a great learning experience for sure. And I came out of it feeling a lot more confident with working with patients with scoliosis.
Yeah, that I agree too. That's one of the things I think I've talked about the most about the algorithm is it's easy enough to say in terms of thinking clinically about the rationale for overcorrection, when to apply it, when not to apply it. But that gray zone of selective is really that sweet spot where
Yes.
it gives you I almost think of it like a smaller algorithm, a sub
Yes.
algorithm to kind of say, okay, this is how we're going to safely try and
Yes, and I
see.
think that like
Yeah,
selective overcorrection, where you're using your clinical rationale to determine whether you're going to do it or whether you're not, like I don't want to say there's never a wrong answer, but like as long as you have your thought process in check, like try it and see what
right.
happens.
Right. It gives that guideline to that
Yes.
process, which for me is really helpful because sometimes my patients might have goals that are more aggressive than I would normally choose to be, or vice versa. Maybe my patients' goals are very minimum and they are not very risk tolerant and they don't want to risk anything, right? I can give them both of those options a little bit more nuanced in discussing, and creating a patient shared decision making plan of care for them. And I really, really valued that explicit discussion and some of the actual new exercise and facilitation techniques that we learned in this course really, I think, helps to fill that space that
Yeah, and I
I
think the
was living
discussion,
in for so many years. No, go ahead.
I was gonna say, like, I think the discussion on how to whether to do selective overcorrection for older adults was
Yes.
especially important too. Um, because I know when I worked with um, my older adults in the past, like there would come a point where I felt like, I feel like there might be something more we can do, but I just don't know what it is.
Yeah.
Um, and I feel like if I had known that back then, like maybe we would have had a little bit more of a successful outcome than.
Hmm.
Mhm.
Yeah, I agree. That's a really important patient population when we talk about, because the history of scoliosis, like you said, so much has changed, even in just the, you know, decade and a half of your sister's time frame, or 2 decades. But thinking about women that are now a pre-menopause or menopause, right, which is a huge growing patient population. And the
Uh-huh.
reality is, historically, and even still sometimes today, right? Our kids, whatever their treatments were, whether it was non-operative or even operative, they hit 18 or 21 and it's like, that's it. You're
Yeah.
out of the pediatric healthcare box
Yeah.
and you just go about your life, right? It's usually like college and family or whatever, and work, and you're in your career or your time, and maybe there comes a time where they're not really thinking about it. Nobody gave them any follow-up recommendations. It's not like back 30, 40 years ago, it was not the standard of care to say, make sure you check on your curve every 10 years, or no, right? We
Mhm.
didn't know what we know now about things like a little more granularity for Cobb angle size or the curve type and location, right? Knowing now that thoracolumbar curves and single lumbar curves or asymmetrical single curves like the 3C, they have a tendency of creeping a little bit. Why? Because they're biomechanically off balanced, right? And so maybe the smaller balanced curves might not. You know, the
Mm-hmm.
whole world of vertebral rotation that we're following now. We just didn't know some of the factors that may or may not impact women as they enter perimenopause or menopause itself.
Mm-hmm.
And that stage in life has such significant physiological changes. Why would we not be surprised that it's all of a sudden creating significant changes in their curve? Even if
Yeah.
they had no pain and thought it was all stable all those years, all the babies and the work and the careers and everything else. And now all of a sudden it's sneaking in with a little more episodes of discomfort or symptoms or aesthetics, like they really feel the changes in their body and the shape. And so now, if we have someone, a patient again, whose goals really are to, they're not degenerative scoliosis, so they're a little more aggressive and they really want to resume,
Yeah.
it's worth trying if that matches our patient's goals and stuff. And I love having that safeguard option of selective overcorrection out of the algorithm. I think it's going to impact our younger, healthier, older aging women,
Yeah.
especially
I,
in that perimenopause, so
yeah,
that
I
maybe we can
completely agree.
impact their health and wellness and how their long term, what that curve looks like at 45. We might be able to impact it so that it doesn't become a debilitating problem at 75,
Yeah.
you know? So yeah, it's a whole lot of new and interesting areas of research that are emerging and growing. And I'm really excited to bring this clinical level of expertise forward. And I'm
Yeah,
so
it's
glad you
so
enjoyed the
exciting.
course.
Yeah, I know. Yes. I think knowing that you and Chintan have like taken all these different courses and this is what you are putting forth and supporting, I was like, oh, there has to be something about this that's magical. And yes, there truly was. And then also hearing about Nikos's background and how he like developed this through years of practice and, kind of through a lot of experience. I really do think like it is game changer for all of us new
Yeah.
learners and also seasoned um,
Yeah,
therapists as well.
he's really brings quite a leadership to this group internationally.
Yeah.
He was just in Eurospine
Hmm.
in Copenhagen, and he had several abstract presentations and an e-poster and a learning educational presentation, and overall as the whole team. And it was, I'll be honest, we were a little fangirling because
Sure. Yes.
the current president of Scoliosis Research Society, Dr. Sukin Shah, who Chintan and I know well from the Northeast, our years, and we highly, highly respect him and really value his insights, especially we have had past conversations about this evolution of comprehensive care for scoliosis, non-operative, as it's growing and changing in light of emerging research and so forth. And we were like so excited because in his keynote lecture at Eurospine, he mentioned Nikos's paper about providing options, even for really, really large surgical size curves, because in his region of the world, and certainly I'm sure we have a few in the United States and
Mhm.
in North America, there are some people that absolutely refuse to have surgery, and that's it. They
Yes.
just simply, that's where their line in the sand is. And to be able to offer them something that is comprehensive, has emerging research behind it, and that we can at least step in and help whenever they need it in some way for those people was, something that just simply was not usually considered, and now with the emerging research and the papers and the discussion, it was really nice to see that that's coming together, that even some of the world leading surgeons are starting to take a look at the growing body of literature behind scoliosis specific exercise and bracing, and starting to think about it, not just in these boxes of, pediatric care, but across the lifespan, and how it might impact people at different stages and seasons of life, pregnancy, menopause, aging, all of these things are factors, along with the genetics that come into it, as well as we unpack more of that in the research. So it's exciting to be a part of a team that is really, full steam ahead.
Mhm.
I always say Nikos has got more energy than I can even begin to
Mhm.
I get tired sometimes just having a conversation
Oh.
because he's always got so many different things going. He just has that great mind, that
Yes.
can tolerate and that level and that speed of work. And he also doesn't have children yet, so I
I'm
tease
sure
him.
that
I
helps.
tease him that may take down his production level a notch
Yeah.
or two, as it hopefully should, because they do step into a priority space for us, our kiddos, which we love
Yeah.
them. But until such time, I suspect he'll be going 90 miles an hour,
I believe it.
research and encouraging and bringing that whole team together.
Yeah.
So I'm looking forward to what the future
Yeah.
holds for scoliosis research and scoliosis care and multidiscipline healthcare. And I'm super excited that you're going to be a part of it.
I
So
know. I'm so
looking
excited to be
forward
a
to
part of it.
it.
And
I know.
I'm truly very grateful I got to take this course and learn so much more. And like I said, I do think it's so valuable for new learners and seasoned therapists both. Just the level of clarity that you gain from the course.
Yeah.
Yeah.
Cool. All
Yeah.
right. Thank you very much for the discussion today, and I look forward to chatting with you.
Thank you for having me.
You're welcome.
Bye.
Bye.